learn how to access healthcare with ease. What if health comes to you instead of moving? Sit back. Let's introduce to you our one-stop solution.
Oh yes, health is a state that allows the individual to adequately cope with all demands of life, which implies the absence of disease and impairment. The World Health Organization also describes health not just the absence of disease and impairment, but also a complete physical, mental, and social well-being of the individual. This means health is a resource support to individuals' function in wider society.
Healthcare seeks to maintain and restore health by treatment and prevention of diseases, especially through trained and licensed professionals in disciplines such as medicine, pharmacy, nursing, among others.
Most people in African societies face challenges affecting healthcare. Most of these challenges facing individuals are geographical clinician storage issues. Most clinicians are normally available in the city than they are in the rural areas. That is, clinicians are more in the cities than in the rural areas. Limited appointment availability, that is office hours. Doctors are normally available from 2 to 5 or highest from 2 to 8, and after this time they are not readily available.
Speaking of healthcare, the lack of proper healthcare can be very detrimental to a society. Taking into consideration two diseases, malaria and cholera, these diseases are allowed to kill millions of people every single year. You and I would agree that malaria and cholera can be easily prevented or eradicated by the provision of proper healthcare systems or proper medications. Taking cholera for instance, it's a disease that spreads very easily. This disease is allowed to infect whole communities or societies, and in the end affects the whole community.
After a survey was conducted in Central University and its neighboring communities, it was realized that there were a few and distant healthcare facilities available to most of the people and the students around. They tend walking far miles to attain medical care, and others even join long queues until it is their turn for them to receive medical attention. As a result of that, they concluded that they would rather sit in their various homes and hope to get well than rather going through all these epic situations to just in search for medical attention.
Due to these problems, some students and other people have adopted the practice of self-diagnosis and self-prescription, where based on some few symptoms or some physical signs they see, they tend to make conclusions based on health problems or diseases that they are facing. They take in medications with the aim of soothing or preventing or helping them to cure a particular disease they are facing, not taking into consideration that most diseases or most health problems have similar or related symptoms.
The healthcare professionals attest to the fact that most of the people do not share to them most of the situations and the issues they are facing relating to issues such as sexually transmitted infections, among others. Most of the people believe that their little secrets are not safe out there when it is with those medical professionals, and so they either do not go to them for medical attention or rather stay in their various homes and keep those little secrets with themselves.
There are some instances in our various health facilities where guidance of patients or even patients themselves are sometimes sent outside from the facility to get a particular medication or a drug that is needed to aid in their treatment.
What if it's possible for people or students not to always walk around in search for pharmacies and healthcare services? What if the pharmacies and the healthcare services could rather come to them? What if students can anonymously interact with health professionals to share their problems? The solution to the problem is the Pocket Clinic. The Pocket Clinic is a modern, smart, hassle-free offline medical care, a friendly healthcare experience for everyone, connecting patients to healthcare professionals. Have unlimited consultation with a qualified health practitioner about any health-related topic anywhere through the Pocket Clinic app. Each person above 18 years can talk directly to a health practitioner via phone or via a live chat. You can view consultation notes from your medical practitioner after the consultation is over. Each person's health records are strictly private to them. For laboratory or diagnostic tests when already in anguish, book a laboratory service visit at home within seconds through the Pocket Clinic app. An accredited lab scientist will visit your home for medical tests of the patient. Results will be emailed to you. Prescribed medications are delivered at your doorstep. Relief of payment through multiple payment methods for the ease of everyone. Pay through mobile wallet, debit card, credit card, bank transfer, or cash on delivery. And receive follow-up calls after every medical consultation. Book diagnostic tests like X-rays, electrocardiogram, ultrasound, echocardiogram tests to be scheduled at your own convenience.
So why should I subscribe to the Pocket Clinic service?
Your personal health practitioner on phone. Get first advice from a qualified health practitioner. No walking, sitting, and waiting for hours in the hospital queue. Weekly tips on general health, mental health, chronic illnesses, and provisions of needed medical supplies.
So is the app free to download?
Yes.
What are the various plans that I can use?
Kindly visit our policy page for more details.
Who are the health practitioners for Pocket Clinic?
Our team consists of licensed medical practitioners, both medical officers, physician assistants, available for a private and confidential consultation over the phone. All practitioners are licensed with Medical and Dental Council in Ghana, licensed laboratory scientists, nurses, pharmacists. Our team strictly follows our international health protocols from the World Health Organization, as well as current Ghanaian medical protocols, to provide you the highest quality of services. Our health practitioners speak a variety of languages, including English, Chi, Ga, Fanti, and Hausa.
So here are some benefits of the Pocket Clinic app. It is user-friendly because it uses simple and familiar language. Also, it's easily accessible, affordable, and distance eliminated. Your needed medications, your drug supplements are delivered at your doorstep without any hassle. There's flexibility of time and saving of some money compared to the one-on-one consultation with a doctor, where one has to travel a long distance to access healthcare. Why choose the Pocket Clinic app? The Pocket Clinic app has value for your time and your money. Your confidentiality and your privacy is assured. One interesting fact is that you can still access healthcare on the Pocket Clinic app once you are offline. Here are some rewards of investment in the Pocket Clinic app. The app will be extended to the national and international levels so that investors will earn much profits. Also, other medical supplies shop will be brought on board to help facilitate the expansion and the growth of the business. Finally, alliance with hospitals and acquisition of private ambulances to improve emergency health services.
A lot has been said about the Pocket Clinic app. Why don't we watch an overview or a brief video on how...
Your health master.